Hi, this is Michael Kaplan. Welcome to my YouTube channel, New Zealand Brain Health. We're going to be introducing a few patients to you, and we're going to do it in two parts. The first part, we're going to introduce a patient with Constraint Induced Therapy. He was already into his therapy for a couple of weeks, or actually for just a few days, and then we're going to interview his wife. In the second video, we're going to be talking about mirror therapy, showing about how a person progresses with mirror therapy and how it uses. And then the last patient will be a patient that has already used a combination of techniques and has made fantastic improvement. We don't just use these therapies. We also use a variety of different medications to help facilitate recovery after stroke, such as dopaminergic drugs and serotonergic drugs. Anyway, so we'll get on to the video in just a few minutes, and I hope you enjoy both parts of the video. Be sure to watch the other one, the other second video, and be sure to subscribe as well. We look forward to your comments. Hey Richard, is it okay that we use the beginning of your therapy on a YouTube video?
Yep.
That's okay. So what we're going to be discussing is Constraint Induced Movement Therapy, and this is the beginning. So your left hand we have is your good hand in a mitten, right? No problem using that. And what we're going to do is hopefully make some good progress with your right hand. Now, can you try to put your right hand up on the table for us? So it's a little awkward, isn't it?
Yes.
And now what we want to do is show them, before we do constraint-induced therapy, how you are lifting that ball. Okay. Try to grab it tight. Good, good. And can you put that ball inside this bucket for us? Okay, good, good. Excellent. That was actually better than I thought. I think a couple of days of therapy, you've already made improvement. Can you grab another ball out of there for us? It's tough, huh?
Yeah.
Do you want me to try to get it for you in the beginning? Okay, let me put it for you on the table. Okay. See if you can reach that ball. There you go. I'll hold it stable for you. There you go. Grab it as much as you can.
Yeah.
Okay. Now try to put it into that bucket.
No.
That's okay. Don't worry about it. Good. You caught it. Excellent. Here, let me get it for you. And this is called Constraint-Induced Movement Therapy. It's very frustrating, isn't it?
Yeah.
Very frustrating. We understand that. But the idea is to try to use your brain to stimulate some cells to regrow. There you go. You got it now. Beautiful. Grab it tight. Squeeze it, squeeze it, squeeze it. Put it into that bucket.
Yeah.
Excellent. 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 Now, one more thing we want you to try, if that's okay, all right?
Yeah.
Take your right hand, your stroke hand, and try to scratch your head for me. Try your best. Try your best. Will you help him put his... Oh, there he goes. There he goes. Now move your finger on top of your head. There you go. Good. Best you can. Best you can. Okay, beautiful. Frustrating.
Yeah.
Good. All right. Well, what we're going to do... Oh, good. You wiped your nose with your hand. So let's take off the mitten on your good hand. And let's see you scratch your head. No problems. Let's see you take a ball out. Well, do it again for me, please. Take a ball out. Good, and then put it into the other bucket. No problems at all. So the idea, and put this one back in. So the idea is to try to train your brain to use that right hand again. So the goal here is to avoid what's called learned paralysis, which means that our stroke hand is so weak that we tend to avoid using it. And by constraint-induced therapy, it forces us to use the stroke hand. Even though it's very frustrating, it helps facilitate recovery in a much quicker manner. Hi, Vivian.
Hi.
What we did is we just saw Richard try using his right hand, his stroke hand.
Yes.
And how did he do today compared to a few days ago?
I was really surprised how well he did, because he got that first one in quite quickly, and that certainly hasn't happened before. The first one we did took 40 minutes to get in.
So just a few days of the constraint therapy and regular therapy, and he's already made improvement.
A couple of days, yes.
A couple of days. And he hasn't even tried all that hard because it's very frustrating, and it's understandable. Well, we hope we'll be able to complete it. And I have a lot of high hopes.
Me too.
Thank you a lot for letting us use this video.